Can you hear that? Me too.
Oh, no, 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 no.
Kidding aside, well, your heart pumps blood around your body in order to provide your cells with oxygen. Hi, welcome to Good Doctor. It's me again, Shani, your friendly pharmacist. The pumping of blood puts pressure on the walls of your blood vessels. This is referred to as blood pressure. Blood pressure is a fundamental physiological parameter that plays a crucial role in maintaining our overall health and well-being. It is a key indicator of the cardiovascular system's function and is closely linked to the health of our heart and blood vessels. It is represented by two numbers. The top number, which is the systolic blood pressure, the pressure when the heart is contracting, and the lower number is the diastolic blood pressure. It's the pressure when heart is relaxing. Most of the time, blood pressure is taken from the brachial artery in your upper arm. Because if the pressure is high there, it's probably high throughout the artery. Increasing blood pressure can significantly increase your risk of developing heart and kidney disease. Blood pressure is a summary of the things happening in your cardiovascular system. It is composed of one is our heart rate, which is the number of times your heart beats and measured per minute. Second is our stroke volume, and that's how much blood is squeezed out of the heart with every contraction. And the third is peripheral resistance, which is used to create blood pressure and regulate the flow of blood. The first heart sound, or the loudest heartbeat that you can hear during monitoring, is often described as loud. This marks the start of the heartbeat when the ventricles contract. The second heart sound, or the softest heartbeat that you will hear, is often described as dub. This marks the ending of systole and relaxing of heart. The lub-dub sound is a fundamental component used by healthcare professionals to assess the rhythm and function of the heart by listening to its sound. Abnormalities or variations in the sounds can be an indication of heart conditions or disorders. Normal blood pressure is where your systolic pressure, or the top number, is less than 120 millimeters of mercury, and your diastolic pressure, or the bottom number, is less than 80 millimeters of mercury. If you are below this number, make sure to check your blood pressure at least twice to thrice a year. If your pressure is 120 millimeters of mercury to 139 millimeters of mercury, over 80 millimeters of mercury to 89 millimeters of mercury, you should monitor it closely and make healthy lifestyle changes. If you have a pressure of 140 millimeters of mercury over, and you are not already being treated for high blood pressure, seek medical attention. If you are being treated, make sure to take your prescribed medicines. Ask your healthcare provider to check your blood pressure during visit or to check your own pressure. However, it's important to note that blood pressure can vary slightly among individuals, and what's considered normal can vary based on factors like age, gender, and overall health. There are two main types of devices used to check blood pressure: manual blood pressure monitors and automatic or digital blood pressure monitors. Under manual blood pressure monitors, we have anaeroid sphygmomanometer. This is a traditional and commonly used manual blood pressure monitor. It consists of an inflatable cuff, a pressure gauge, which is called manometer, and a stethoscope. The cuff is wrapped around the upper arm and inflated with a squeezed bulb. While slowly releasing the pressure, a healthcare professional uses a stethoscope to listen for the sound of blood flow in the brachial artery, and the diastolic pressure are noted on the manometer scale. Next one is our mercury sphygmomanometer. These monitors are similar to aneroid sphygmomanometers but use a column of mercury to measure pressure. They are less common due to environmental concerns associated with mercury. Under automatic or digital blood pressure monitors, we have our digital automatic blood pressure monitors. These are electronic devices that are widely used because of their convenience and ease of use. Here's how they work. The cuff is wrapped around the upper arm. With the push of a button, the monitor automatically inflates the cuff, measures blood pressure, and displays the results on a digital screen. Some digital monitors can store multiple readings and calculate an average over time. Next one is our wrist blood pressure monitors. These monitors are worn on the wrist and are smaller and more portable than our monitor. However, they may be less accurate than our monitors because wrist position can affect the readings. High blood pressure has a few warning signs and usually doesn't cause any symptoms. Many people may not know that they have it until the damage has occurred. Don't wait until it's too late to control your pressure. Get your blood pressure checked regularly. Remind your healthcare provider or your pharmacist to talk to you about your pressure and know the warning signs. Be physically active. If you smoke, get help to quit. Practice other good health behaviors and take prescribed medicines as directed. High blood pressure is within your control. Remember that small changes in your daily routine, like eating a balanced diet and managing stress, can make a significant difference in your blood pressure levels and overall well-being. Your heart health matters, and by prioritizing it, you're investing in a brighter and healthier future. Now, let's have a quick question and answer. Round 1. What is more likely to help manage hypertension? Garlic or orange? If you answered orange, you got it right. Not only it has high antioxidants, but also helps to lower down bad cholesterol levels. While few studies show that garlic also helps lower down hypertension, however, it has not been proven because of lack of evidence. Round 2. What is more likely to cause high blood pressure? Cigarettes or being mad? If you answered cigarettes, you're right. Being mad all of the time can increase your pressure, but just for a short period of time. It's not a direct cause of high blood pressure. Round 3. What is allowed to drink to those persons with increased blood pressure? Alcohol drinks or red wine? The answer is, of course, red wine. Red wine has a polyphenol which lowers blood pressure, while alcohol drinks will just make you drunk. Let me know in the comments below if you get all the correct answers and what topics you want to know more about. Thank you for watching The Good Doctor, and see you next time.
To proceed with free online consultation, click the link in the comment section.